Scope of Practice for Advanced Practice Nurses by Priscilla RN BSN. One major global issue for the advanced practice nurse is our role and scope of practice. Evidence supports that we are a valuable part of the healthcare system in terms of quality and cost effectiveness. However, the question still remains how we can clarify our role and standardize our practice for the entire profession. The practice and role of an advanced practice nurse significantly varies from state to state. What one can do in one state, one is prohibited to do in another state. This can be very confusing for the general public as they travel from state to state to receive care, as well as for the professional advanced practice nurse who would like to travel and continue with their practice. There are a lot of blurred boundaries when it comes to our practice and our role. I just wanted to look at a few terms that related to the advanced practice nurse. First one, CNS, clinical nurse specialist, NP, nurse practitioner, CNSP, adult psychiatric clinical nurse specialist, FNP, family nurse practitioner, ANP, adult nurse practitioner, PMHNP, psychiatric nurse, mental health nurse practitioner. And this is just a few of our titles. The boundaries of the advanced practice nurse is becoming more and more blurred. Many people, including nurse practitioners, are unable to see the line that should form a boundary of professional practice in the real world of clinical practice. Two examples that I want to bring out to really show how blurred our boundaries can get when it comes to care is the family nurse practitioner and the psychiatric clinical nurse practitioner. The question is to treat or not to treat. An example of a patient with schizophrenia will obviously be being seen by the psychiatric clinical nurse. A common illness that runs in schizophrenic patients is diabetes. With that, mental health nurse practitioner treat their patient for schizophrenia as well as diabetes, or would that patient have to see both the family nurse practitioner and the mental health practitioner? Another example is a family nurse practitioner seeing a patient that begins to complain of small depression. Would the family nurse practitioner treat that depression, or would they be referred over to the mental health? Hypothyroidism is a big one that also runs with a lot of mental illnesses. Should the mental health nurse practitioner be able to prescribe hypothyroid medication for their patient with the mental illness? Or would that patient also have to go and see the family nurse practitioner for that? And we have to really think about those nurse practitioners that are in rural areas. They may be the only provider for another 3 or 4 hours. Are they being equipped with everything they need to help their patients live healthier lives? The big problem with our scope of practice, not just for the nurse practitioners in rural areas, but the fact that studies show that at least 50% of mental health patients will present to their primary care provider for assessment. That is your family nurse practitioner. Family care providers will diagnose and manage over 30% of these patients. It is also estimated that 45% of patients with chronic medical conditions also have some sort of psychiatric illness. The practice of the advanced practice nurse is evolving so fast, legislation cannot keep up with us. Traditionally, the family nurse practitioner would focus on health promotion, disease prevention, and management of chronic illnesses. Within the recent years, decade or so, outpatient visits have exploded as inpatient admissions have declined. And the result of this is that Patients with complex, acute, and chronic problems are now being managed outside of the hospital setting by those same family nurse practitioners. The reason we see this big shift from inpatient care to outpatient care is a shift in the priorities of the delivery of the healthcare system. And there are many reasons why the healthcare system has changed or shifted in this direction. I just brought up the top three reasons. The increase in chronic illness. This is due to poor diet, lack of exercise, obesity. The fact is, we're sicker now than we've ever been before. The second reason is the growing aging population. Baby boomers are getting older. They need a lot more care than what we thought they would need. The third reason is because of the price of healthcare. Now we want to shift to be more cost effective, and then we want to have quality of healthcare with evidence to support our outcomes. And through all of that, you see the advanced practice nurse trying to bridge the gap of care, trying to help doctors, physicians provide the best care. And unfortunately, legislation just has not caught up to us, and we're sometimes caught in a battle. Like I said before, legislation is trying to address some of the issues. When they passed the Affordable Care Act, the purpose was to increase the access of care to the many, many Americans that aren't getting health care right now, and to decrease the cost of care without jeopardizing the quality of care. And all that boils down to, if all the people can get more care and more access to care, then we're going to need a lot more care providers. So we're going to need a lot more nurse practitioners, a lot more doctors to carry the load. In one article for 2010, Institute of Medicine, they recommended that the scope of practice barriers for nurse practitioners be removed, allowing us to practice in full extent of our education and training in preparation for the continued shift of the need of healthcare providers. And when we're thinking about expanding our scope of practice, we have to really key in on how that is going to be done and how it is going to be done effectively. And the key to all of this is legislation. Not one person can do it on their own. The three ways that legislation can help us is directly. Directly is the most common way that we go about changing laws through the administrative modification of laws. But there's also indirectly, we can get some laws changed. An example of an indirect law would be legislation can authorize another medical profession, and the effects of that can affect nurse practitioners as well. One example of that is in New Hampshire. They ruled on broadening the scope of practice for acupuncture, and somehow that gave nurses more room to practice, not advanced practice nurses, but nurses. And the last case that can help us change laws is judicial, and that would be in the form of a case going to court and the actual court system stating that, this is in their scope, or this is more of their scope or less of their scope. So hopefully everyone can get busy. It's not just enough to practice well, but we have to get involved with our law system and try to let our voices be heard, get on different councils and write your legislator and get everything going. Thank you.